Welcome to The Explainer. We are transforming the absolute latest clinical data into a proactive, evidence-based toolkit to really master your cardiovascular health. We're moving completely beyond that basic advice you've probably heard 1,000 times by now. Instead, we're going to lay out a structured, step-by-step playbook designed to give you total agency over your heart health. Let's get right into it. 130/80. Seriously, let that stark number sink in for a second because it is the new clinical threshold for elevated blood pressure according to the American College of Cardiology and the American Heart Association. Now, what does that actually mean for us? Well, it means nearly half of all U.S. adults are now actively sitting in the danger zone. High blood pressure is notorious for being a silent killer precisely because it rarely shows any obvious symptoms until some pretty significant damage has already been done. So, where do you actually fall on the spectrum? Knowing exactly where you stand clinically is your absolute first line of defense. The moment your systolic pressure, that top number, crosses 130, you're officially in stage 1 hypertension. Finding your personal baseline is incredibly important before we start exploring how to actually bring those numbers down. Here is the thing. While high blood pressure is linked to some really severe long-term complications, like cognitive decline and dementia because it damages the blood vessels in your brain, you actually have an immense amount of power to change that trajectory. Tiny physical changes yield immediate, highly measurable relief for your heart. Get this. Clinical data shows that dropping just a single kilogram of body weight, that's literally just 2.2 pounds, decreases your blood pressure by 1 millimeter of mercury. Small changes absolutely compound into massive cardiovascular benefits. That brings us perfectly to Pillar 1, Master Home BP Monitoring. We call this the Measure Pillar. You know the old saying, you can't manage what you don't accurately measure, right? But ironically, your doctor's office might actually be the absolute worst place to check your numbers, thanks to a documented clinical phenomenon called white coat hypertension. Just being near a stethoscope is enough to stress a lot of us out and artificially spike our readings in that exact moment. Relying purely on those in-office checks could actually lead to an incorrect diagnosis or even unnecessary treatment. Home monitoring solves this whole problem by giving you a realistic picture of your everyday resting state. But if you're going to measure at home, you've got to do it right. You must follow a few precise clinical steps to make sure your reading is actually accurate. If your cuff is too big, your reading might show up falsely low. When you sit down, your back absolutely needs to be supported, your feet have to be totally flat on the ground, and your arms should rest comfortably at heart level on a table. And here's a big one. After you take that first reading, you have to wait 1 to 3 minutes before taking a second reading. This ensures your body has fully settled. All right, moving right along to Pillar 2, DASH versus the Mediterranean diet. Welcome to the Modify Pillar. These two diets completely dominate the cardiovascular conversation, but they actually serve slightly different purposes. The DASH diet, it's a highly structured clinical tool built specifically by the National Institutes of Health for rapid blood pressure drops. It heavily restricts sodium and leans hard on low-fat dairy. The Mediterranean diet, on the other hand, is a much more flexible, lifelong wellness approach. It focuses on overall heart and brain health, embraces healthy fats like olive oil, and really integrates the cultural and social aspects of eating. Now, if your goal is aggressive, rapid results to fix a high reading, the newest guidelines suggest a really hard cap on your daily sodium, and that number is just 1,500 milligrams a day. That is significantly lower than what the average modern diet contains, but if you have prehypertension, hitting this specific target using the DASH framework is a proven clinical way to pull those numbers down super fast. Let's stay on the topic of food for a second and look at some surprising blood pressure nutrients that can give your cardiovascular system an extra edge. And yes, we are actually asking, can chocolate lower your blood pressure? I know exactly what you're thinking. Chocolate? Really? No way. Well, a rigorous scientific meta-analysis in the Cochrane database of systematic reviews has a highly engaging, delicious answer for us. It turns out specific compounds in cocoa called flavanols act as natural vasodilators. They actually increase your body's production of nitric oxide, which literally opens up and relaxes your blood vessels. The clinical trials showed this triggers a 2 to 3 point drop in blood pressure. But here is the tragic catch. You can't just go eat standard candy bars. Modern processing completely strips away those flavanols. You need flavanol-rich, sugar-free cocoa to actually see that drop, and studies noted this was particularly effective in overweight adults. Now, take a look at the impact of something as totally mundane as fiber. A meta-analysis published in the Archives of Internal Medicine found that simply adding an average of 11.5 grams of soluble fiber to your day steadily drives down both your systolic and diastolic numbers. Specifically, they saw a 1.13 drop in systolic and a 1.26 drop in diastolic pressure. And the data highlighted that this was especially effective if you happen to be over the age of 40. And please, whatever you do, do not sleep on your B vitamins. Harvard researchers analyzing the Nurses' Health study confirmed that high folate intake can drastically slash your risk of developing hypertension in the first place. Women consuming 1,000 micrograms per day of folate, getting it from a mix of their diet and supplements, had a significantly lower risk of their blood pressure spiking over time compared to those who had low intake. Which brings us to our third and final pillar, mind-body medicine for hypertension. The master pillar. We're going to look at a biological phenomenon that is honestly as clinically powerful as pharmaceuticals: holistic nervous system regulation. The relaxation response isn't just some wellness buzzword to casually throw around. It is a verifiable, highly measurable state of mind-body medicine. It's the literal physiological opposite of the well-known fight or flight stress response. When you induce it, your respiration slows, your heart rate drops, and it actively clears away all that daily information overload that keeps your nervous system constantly on high alert. 1771. That is the staggering number of genes whose expression was physically altered in a Harvard Medical School study. They took unmedicated patients with stage 1 hypertension, put them through just 8 weeks of relaxation response training, and not only did their blood pressure drop, but the researchers documented physical changes in over 1,700 genes linked to immune regulation, metabolism, and cardiovascular development. Incredible, right? As Harvard's Dr. John Denninger points out, engaging in meditation or deep breathing literally rewires your immune and metabolic pathways right down to the cellular level. It protects your heart in the exact same manner you would expect to see in a patient successfully treated with heavy prescription medication, but it's achieved entirely through a mind-body intervention. The best part? Building your daily resilience toolkit doesn't require a mountaintop retreat or expensive special equipment. You can trigger the relaxation response with just a few minutes a day. You can breathe deeply from your diaphragm to pull in way more oxygen. You can do a slow mental scan of your body, intentionally releasing physical tension you didn't even know you were holding onto. You can repeat a calming mantra, walk mindfully by focusing only on your footsteps, or simply focus your thoughts on feelings of compassion and kindness. So here we are. You now possess the ultimate, evidence-backed toolkit to totally dismantle the silent killer. You understand how to measure accurately at home, modify your diet with the right nutrients and strict sodium limits, and master your stress response down to the very cellular level. But the agency is entirely yours now. Knowing the data is only half the battle. So which of these 3 pillars will you start focusing on right now? What small, measurable change will you make today to protect your heart for tomorrow?